Continuing my series on 50 ways to shade, let's talk about another supplement that's been shown to have a lot of benefits with regards to the impact of UV on our skin over time. This would be nicotinamide. Nicotinamide is a form of vitamin B3, which goes by other names such as niacin or nicotinic acid. We get niacin from our diet, from various food items, both plant-based and animal-based, but we can also take it as a supplement. Why is nicotinamide so important for our skin? Nicotinamide itself has been shown to play a very important role as far as DNA repair goes in our cells from UV damage. It has proven benefits in reducing the incidence of non-melanoma skin cancer, which includes both basal cell carcinoma and squamous cell carcinoma, as well as a precursor to squamous cell carcinoma called actinic keratoses. There was a study that was published in 2021 in the New England Journal of Medicine that actually demonstrated that volunteers that took 500 milligrams twice daily of nicotinamide had a 23% reduction in the incidence of non-melanoma skin cancer developing in that time. So that included both basal cell carcinoma and squamous cell carcinoma. It also led to a reduction in the development of actinic keratoses, which is a precursor or precancerous lesion that leads to squamous cell carcinoma over time. There was another study I came across that evaluated the in vitro benefits of nicotinamide in protecting cells from both UVA and UVB damage to melanocytes in particular, melanocytes being the cells that form melanoma, and this study did demonstrate a benefit as well. There are a lot of sources in our diet to obtain niacin, and historically, because there were incidences of a disease called pellagra as a result of niacin deficiency, some foods have been fortified with niacin as well to make sure that our general population gets adequate niacin in our diets. The average adult should be consuming somewhere between 14 to 18 milligrams of niacin equivalents, but there's also another source that we can obtain niacin, and that would be from tryptophan in our diet. Tryptophan is metabolized in our liver to produce niacin as well, and the conversion factor is thought to be about 60 milligrams of tryptophan for 1 milligram of niacin produced. So what are the symptoms of a niacin deficiency? There's a disease state called pellagra, which actually translates to rough skin. There are a constellation of symptoms that you'll see in patients that have a niacin deficiency, and one of the ways it's been referred to is the 3 Ds, which would be dermatitis, dementia, and diarrhea. The dermatitis that patients experience will be symmetric. It'll be in photosensitive areas, meaning areas where light is exposed. The skin gets rough and discolored in particular and inflamed. Patients will experience GI upset, including diarrhea, constipation, and nausea, and they can also potentially experience neurologic or psychiatric disturbances, including depression, apathy, suicidal ideation. They can even experience hallucinations. The people at biggest risk for developing a niacin deficiency would usually be based on a malnutrition state or an undernourished state, as well as some malabsorption states. Say, for example, people who have gone through some GI surgeries that lead to decreased absorption over time. There are a couple of other conditions like Hartneff's disease, as well as carcinoid syndrome, as well as some drug-induced versions of pellagra, such as isoniazid, which is used to treat tuberculosis. One of the symptoms that you can experience if you have an excess of niacin in your system is flushing. If you really need to find out if you have a niacin deficiency, it's worth talking to your doctor about various laboratory tests that can be performed. There are some blood tests and urine tests that can be performed that look for niacin in our bloodstream or various metabolites of it as well that can help us in determining whether or not a niacin deficiency could be present. But also remember, this is something that we can treat with supplementation. I think of nicotinamide as an excellent example of a supplement that we often do give to our high-risk skin cancer patients to just decrease that incidence of skin cancer that they're experiencing, because we know that we can't reverse the past. We can't take away the UV exposure their skin has experienced, but we could reduce the impact of that UV damage on their cells over time to hopefully reduce the actual development of skin cancers as time goes on.